Do you really need a blood test every year to check whether you are healthy or not? Most of the people generally observe a lot of package in a laboratory that offering CBC, ESR, thyroid function test, and liver function test, vitamin B12 and vitamin D3. But you know what are surprising fact? That is not every test is necessary for everyone because some tests are generally used for or generally advised for the diagnosis of disease, but some tests are advised for the diagnosis of risk factor. So guys, in our today's class, we are going to discuss 10 common requested blood tests. All these tests help you understand what each test tell you and why your doctor or health practitioner generally recommend these tests. So guys, first of all, very basic, complete blood count test. Generally when most of the people feel unexplained tiredness or complain recurrent infection, unusual bleeding or brushing, most of the health practitioner generally advise first CBC, complete blood count, because it generally detect the level of RBCs, red blood cell, level of WBCs, white blood cells, and the level of platelets. In case of anemia, that is very common term, anemia खून की कमी हो जाना. In case of anemia, our RBCs level getting down, अपना RBC level जो होता है वो तुरंत नीचे आ जाता है. In case of acute viral infection, our WBCs level get elevated. जिस समय वायरल इन्फेक्शन होता है अपना व्हाइट ब्लड सेल का लेवल ऑल ऑफ सडन बढ़ जाता है. एंड इन केस ऑफ एनी डेंगू इन्फेक्शन आवर platelets level getting very low. So these three parameters, RBCs, WBCs, platelets, are used for the diagnosis of acute viral infection, anemia, as well as dengue infection. The second one is ESR, erythrocyte sedimentation rate. This test is generally used for the detection of any inflammable disease, any infection or any other condition, because if there are any infection in our body, ESR level gets elevated. So this is very common test, are generally advisable by the practitioner to detect any inflammation condition or infection in our body. The next one is TSH or thyroid stimulating hormone test. TSH plus T3 plus T4 plus free T3 plus free T4. All these five collectively called as thyroid profile test. When someone complain about tiredness, unusual weight gain, unusual weight loss, unusual all of a sudden palpitation, generally healthcare practitioner advise for the thyroid profile test because it provides information about the thyroid hormone function. It provides the information whether you are suffering from hyperthyroidism or hypothyroidism. So all these collectively known as thyroid profile test, thyroid function test. After that, there are also very common tests, FBS and PP2BS, fasting blood sugar, and PP2BS means postprandial blood sugar, means खाने के पहले का टेस्ट सुगर टेस्ट, खाने के बाद का सुगर टेस्ट. FBS वो fasting blood sugar test generally carried out after 8 to 12 hours of fasting, and PP2BS generally carried out after 2 hours of complete meal. These tests are generally used for the detection of level of glucose in our body, for the detection of insulin resistance, and this is generally very helpful for the person who have experienced suddenly weight gain, for the person who are suffering from the hypertension, for the person who have family history of diabetes or previously high blood sugar. These are generally used for the detection of level of blood glucose. Apart from this, there are one most important test that is called HbA1c. This is also determine the level of glucose, but it determine complete last 3 months or mean plasma sugar level. From this test, we can determine whether the person is normal, whether the person is pre-diabetic, or whether the person is diabetic. When the level of HbA1c become less than 5.7%, we can consider person as a normal person. But when the level of HbA1c goes above 5.7% but below 6.4%, we can consider as a pre-diabetic person. That generally need to regular exercise, to control diet, to avoid diabetes. And when the persons Having HbA1c level more than 6.5%, we can consider it as diabetic patient, and healthcare practitioner generally advise medicine, medication, anti-diabetic drug to these patients. After that, lipid profile. This is very important test, guys, and this is generally used for the detection of cardiac disease, cardiac risk factor. There are four type of cholesterol that you can see on the screen. LDL means low density lipoprotein. We call as very bad cholesterol, because when level of LDL elevated in the body, it form plaque in the arteries and obstruct the flow of blood, that may result into the cardiac ischemia and heart attack. That's why LDL called as bad cholesterol. Second one is HDL, high density lipoprotein, and it is considered as very good cholesterol in our body because it removes LDL and other bad cholesterol from our body. Next one is total cholesterol and triglyceride. So all these collectively known as lipid profile, and that are generally used for the detection of risk factor of cardiac disease. It can differ to different age person, to the hypertensive person, to the diabetic person, to the person who are chain smoker, and also depend upon the family history. After that, there are some tests related to the liver function test. Whenever a liver cell shows any injury or stress, our liver enzyme gets elevated. Liver enzymes means SGOT, SGPT, also called as AST or ALT. These enzymes generally elevated in case of any stress to the liver or any damage to the liver test. If any healthcare practitioner feel that a person suffering from bloating, person suffering from indigestion, they advised liver function test. And apart from this, healthcare practitioner also advised ultrasonography of whole abdomen as well as fibroscan to check overall picture of the liver. Now, serum creatinine. This is very much important for the kidney function test. It provides very accurate information about kidney function, because level of creatinine elevated if our function of kidney become deteriorated. Level of creatinine along with albumin creatinine ratio determine the overall picture of kidney function. This is generally advisable to the diabetic patient, to the hypertensive patient, to the person who is suffering from the CKD or chronic kidney disease or other certain medication condition. Now, the serum uric acid. This is generally advised to the patient who experiencing joint pain, because serum uric acid generally diagnose sodium urate crystal to the joint. When the serum uric acid level elevated in our joints, sodium urate crystal deposited and cause pain, and that particular condition called as gout. So in case of gout patient, in case of kidney stone patient, healthcare practitioner or doctor generally advise this test, serum uric acid test. Now, the very common two tests, vitamin B12 and vitamin D3 test. These tests are generally used to check the deficiency of these two nutritional supplements, vitamin B12 and vitamin D3. Because due to the deficiency of vitamin B12, individual experiences anemia, numbness or tingling sensation, and in case of any severe deficiency, it also experiences some type of neurological symptoms. Whereas in case of vitamin D3 deficiency, bone health get deteriorated, muscle functions get deteriorated, and it also affects our calcium absorption. So guys, all these tests, CBC, ESR, TSH, fasting blood sugar or PP2BS, HbA1c, lipid profile, CM creatinine, LFT, liver function test, vitamin B12 and vitamin D3, and uric acid. All these 10 tests are very important to check any type of deficiency or any type of dysfunction in our body or any type of infection in our body. But I want to tell you this, all these are not fit for all. It depends upon the risk factor, like for the diabetes or hypertensive patients. Some tests generally advised by the healthcare physician for family history and overweight, or some symptom based tests like gouts and like liver function test in case of abdominal pain. So these are all the blood tests are the tool. These are not the final answer, because abnormality doesn't mean it is disease. Normal doesn't mean you are perfect. All things depend upon the symptoms, risk factor, as well as history. So guys, in today's video, we have discussed a lot of tests. If you feel this video informative, please share to your friends and family. Stay informed and stay healthy. I will see you in the next video. Bye bye.